Okay, so once again, my name is Sebastian Diaz. I'm a breast surgeon, not radiologist, and I'm from Medellin, Colombia, and I'm here to talk about how we reduce from days to hours with our one-stop clinic for breast diagnosis. First of all, very quick numbers. Breast cancer in the world, 2.2 millions. In Colombia, we explain nearly 16,000 of those cases. Breast cancer is the rank #1 in incidence in Colombia in cancer and explains a lot of deaths. It's the rank 3 in deaths because of cancer. And a reality is that those breast cancer deaths that occurs in the world are mainly in the low income and least developed countries like mine. And this is due in part to deficiencies and all the iniquity in management, the barriers that the patient has to pass to access to the health services, and also in the delays to get an early diagnosis and also to receive a treatment in time. This is Colombia. I work in Sura. Sura is an insurance company, a big insurance company. And we had a big population, almost 5 million and growing of attendees and affiliates, and a little bit more women than men. So where do we start? This is going back from 2014, 2015, and we figure out that we have a lot of processes that work like fragmented. Everyone was doing what they think. The oncology providers in one side, the diagnostic imaging services in the other side. We were not aligned at all. And that means operational inefficiencies, and that means unnecessary biopsies, of course. Other thing that we saw was that everything was focused in the cost control, but not on the patient. And that means that we have an opportunity that more than 40 days to get it diagnosed, and all of those diagnosed were not in early stages, where only 36% of those cancer diagnoses were in early stages. That means stage 1 or 2. And the other thing that we saw was that we have a lot of an endless loop with the benign disease. A little girl receives a biopsy, had a fibroadenoma, and then she had like a long, like doing once again ultrasound, rebiopsy, and then the mastologist or breast surgeon received the patient once again by registry, and so that was an endless loop. So we figure out that we have to impact the entire cycle, and we have to impact both in diagnosis and also in the treatment. So this was our picture back again in 2016. We were doing a lot of mammograms. We were doing a lot of biopsies, almost 5,000 biopsies per year. We were diagnosing of those biopsies nearly 20%. Of those, early stage was 63, not bad. And the time was 35 days to get the diagnosis. So we wasn't that bad, but we wanted to do it much better. So in 2016, Dr. Delaloge and Degusta-Roussy, like we already have explained in the past conference, they published their experience with their one-stop clinic, and they conclude that one-stop breast clinic can provide a timely and efficient delivery of highly accurate diagnosis and serve as models of care for multiple settings. So we thought that's what we want to do. So then we stopped speaking with Degusta-Roussy, and then we started traveling, looking for their model, and with the GE in the middle of all this circle, we created our one-stop clinic. We name it Tiempo para ti, that means time for you. And this was born in 2018. So we focus, we have a lot of branches, but first we have to focus in the diagnosis, and so we are receiving patients that actually need a biopsy. We are receiving patients with BI-RADS 4, BI-RADS 5, and also some BI-RADS 3 or 2 that the oncologist or the breast surgeon or some clinic thinks that they need a biopsy instead of the BI-RADS. So our main goal was to improve the quality and opportunity in the diagnosis of breast diseases through a multidisciplinary, and that's very important, and integrative model that guarantees the health results with a great service. And of course, we want to make this like a very good experience for the patients. It's this focus in the patient and not in the costs. So how this our circuit works? We are mainly 4 big scenarios here. We have the nurse navigator in the middle of it, and it's the first step in this circuit. The nurse navigator receives the patient and explains all the dynamic of the circuit, how it's going to be this experience. She attaches and verifies the documentation and exams that the patient already has. Take the patient to the breast surgeon. That's the next step. This is our team, of course, during the COVID-19. And the breast surgeon, that's the first step. That's my step. We describe a complete medical history. We review all the medical exams that the patient already has. We make, of course, a complete physical exam, and we introduce then the patient to the radiologist. Here is very important that we are not communicating with a cell phone or a computer. We actually grab the patient and walk all the way, and we have all the time like this company with the patient. Then the radiologist review all the medical history that the surgeon have done, and the breast image is already done. We make additional images if it's necessary. In this case, we can do mammogram with tomo and also with contrast enhanced mammography. Every patient receives an ultrasound. Of course, we check both breasts, not only one breast, but both breasts, and of course the axilla. For us, the surgeons, is very important to know how's the axilla. And MRI is done if it's necessary, but that is later, not in the same circuit. It's going to be another appointment. The radiologists take the biopsies with the hand with the pathologist. They mainly are doing ultrasound guided, and they can do both biopsies, FNA and core biopsy. It depends the case. And in some cases, we also make the stereotactic in the same route. The FNA, it's a simple procedure. We only need a syringe and a needle. It's cost effective, of course. It's cheap and it's easy with little complications. And the core needle biopsy, it's of course it's easier to make by expert hands, but it has more cost, of course, and they have a little bit more complication. It's not that big, but it can happen. Then the pathologist, it's very important here. They are working with cytology because we are mainly based in FNA. They are using the Yokohama system. And the difference between both is the FNA works with cytology. We have the immediate results. That's very important. It's safe, it's cost effective, and it's done. The only thing is by expert staff. Not all the pathologists can read the FNA. With a false negative, that means 4% of those, and false positive maybe 1%. And the core, it's deferred, but it's a definite diagnosis. We also can make special staining. We can use immunohistochemistry, but the thing is they have a higher cost and it's not immediate. So the pathologist also supports the radiologist while taking the biopsy. They check it immediately. They have to read the FNA and process the core in deferred, and then discuss all the results with the team, and then we validate if everyone is with in concordance, thinking that the diagnosis is the one that we were thinking. Then the patient goes once again, they return to the breast surgeon, and the breast surgeons communicate the result to the patient, answer question and resolve all the doubts that the patient has. We define a management, a possible treatment if they need it, or if they need a follow-up, we define which follow-up and who is going to do it. And if we have a cancer, we have to establish the TNM classification, because we also can do additional exams before they arrive to the breast surgeon that is going to treat the patient. The nurse navigator, once again, they receive the patient and they make basically schedule additional studies if they're needed, and make appointments that the patient need. And in some cases, we have 5 clinics all around the country, and in only one clinic we already have the psychology, and we are using it in every patient in this clinic, but mainly to make intervention if we got a crisis in case of diagnosis. So maybe in some cases, not all cases, we're using it. So our results, we have already attended 20,000 patients with this model. This is very important. We have not doing biopsy in 26 of these patients that we before, of course, we maybe have done that biopsy, but in this case, we're not doing it. That's very, very important, because these multidisciplinary teams, there's the breast surgeon and then the radiologist check, and they say, no, we don't need biopsy in these cases. So that's very good. Of those biopsies that we have done, that's 74% of all those patients, we have diagnosed the same percentage of cancers that before, 20%, and the rest, 80%, is benign diseases. This is very important because only with FNA we have diagnosed the middle of all of those biopsies. So that means time, that means less complications, that means cost effectiveness in this case, with very good results. We have a sensibility of 96.1%, a specificity or 99, so very good. And this also means, like I already said, economic impact. We are saving the users a lot of money. They only have to make one payment in this same clinic, no matter what kind of biopsy or what kind of exams have we done. Maybe 1 biopsy, 3 biopsies, MRI, whatever. They only have to pay an average of 10 euros, and that's it in one clinic. And of course, only doing the things well, we're, as a company, also saving a lot of money here. We also check not only medicine, so we want to check how is the patient experience. Like, it's not good that you said you had a cancer, but we measured how the patient's treated and how they feel it, and the general satisfaction is 4.7 out of 5. They qualified the experience as very positive, 85%. They recommend the experience, and the most validated attribute is the empathy of all the multidisciplinary team. So this is our actual photo. This is 2022. We're doing a lot of more mammograms right now. We're doing, check the numbers that we had before. We're doing a lot of more mammograms because our population is growing. When we started, we were like almost 3 million. Right now, we're more than 5 million, and so we're doing more mammograms, but we're doing less biopsies. We're doing only 3,000 biopsies in the year. We started with almost 5,000, but we are diagnosing the same percentage of cancer. And we are also diagnostic with 66% in early stages. And the most reduced thing is that we have the time between suspicious and diagnosis just only in 6 days, back where there were 35 days. So that's really good. We have a lot of communication strategy. We send emails, make campaigns, alliances with a lot of foundations and everything. So we are a lot of communication and marketing about this. So our achievements of our one-stop clinic is first elimination of authorization processes. Significantly, we reduced the diagnostic times. We gathered the diagnosis of breast pathology in only one place. We have reduced a lot of unnecessary procedures, and very important. We are looking and we're under study how we are impact in the survival and quality of life. We're under study and we are waiting to have 5 years to make this study. We're just waiting. Our biggest oncologic achievements, 6 days between suspicion and diagnosis of breast cancer, 14 days between the suspicion and the first oncologic appointment. That could be with a breast surgeon or an oncologist, but mainly with breast surgeons. General satisfaction is really great for the patients, and we have reduced the time between the suspicion and the first oncologic treatment. That means surgical procedure or first chemotherapy to 31 days from the suspicion. So thank you so much for the opportunity. Gracias por la invitación y obrigado.